the right place. So I, Dr. Kumud Madan, welcome all the students, all the aspiring pharmacists. Our guest of the day, Mr. Arjun Dasundi, Associate Vice President, MWay India, to this webinar series part 1 on this Saturday morning. A very warm welcome, sir.
Thank you.
Yeah. So before do I ask you to address the audience today, sir, with your kind permission, I would just like to give a brief snapshot of my institute.
Sure.
Yeah. So Lloyd Institute of Management and Technology, that has been established in the year 2004. We started our post-graduation program in the field of pharmaceutics in the year 2001. And in 2011, we further started PG studies in quality assurance as well. In 2016, we launched the program Niyukti, that is the Lloyd Job Annual Fest, which brings all the job seekers as well as the industrialists to take the right choices. In the year 2018, we got the NB accreditation, and we are promoting the international quality standards for the technical education in India. We also collaborated with the only pharmaceutical university of India, that's DIPSRU, for academic and the research purpose. Now, these were our milestone and still many more to come. The 17 years of excellence has really witnessed great number of achievements. In the year 2020, we started the Diploma in Law and Pharmacy under National Skill Qualification Framework, Ministry of Skill Development and Entrepreneurship, Government of India, and we are still running with the batches. In the year 2021, we have been approved as approved research center under Dr. Abdul Kalam Technical University under the kind guidance of Professor Kanchan Kohli, who's looking after the research cell. We have been receiving the Best Pharmacy College Award in the Uttar Pradesh for outstanding and exemplary contribution towards education, skill development, and research. Besides that, we have all new campus, that is Lloyd School Pharmacy. So basically, we are running pharmacy in two institutes. One is LIMT and other is Lloyd School of Pharmacy. We also collaborated with the Daleview College of Pharmacy and Research Center, and we are about to start, fortunately, undergraduate program in forensic sciences. So these are few of the achievements. We have sophisticated analytical instruments lab. The students who are really looking for the research, they must be contented that they're at the right place. We have another modular lab of the drug designing, which is equipped with the software ligand Scout. And very recently, we have been given the recognition of the DSIR, that is Department of Scientific and Industrial Research, which is a big achievement and recognition to be recognized as Scientific and Industrial Research Organization. So these are some of our unique selling points. Just to cut short, we have NB accreditation, we have research collaboration with various other universities, and still MOUs are going under. We have skill development programs.
I think, take it. Yes, fine.
Yeah, and we have competent and talented faculty as well. So Lloyd has
well, it seems there is a technical glitch with Dr. Kumud's system, so we'll continue. Right. So, sir, I welcome you again. Candidates, a very good morning to all of you, and good morning to our guest speaker, Mr. Arjun Dasundi, who is Associate Vice President, MWay India, and is also amongst Forbes' top 100 great people's manager. Welcome, sir. I'm honored to welcome you at this platform. I also extend a warm welcome to all of our new pharmacy entrants and prospective students. Each one of you deserves to be congratulated for having made the right career choice and also choosing one of the best colleges in the NCR. You all must be aware about the fast growth and expansion of pharmacy profession and pharmacy sector as a whole, particularly post-COVID, and MWay is deeply connected to pharmacy with the integration of products like nutraceuticals, cosmetics, herbal products, and dietary supplements. Students' vision Pharmacy 2047 emphasizes on wellness, not illness. So these products of MBA are a key player in wellness, and our college integrates well with these products. Lloyd as an institute believes in an industry integrated education, and keeping our legacy, we have organized this program and continue to organize such programs in future also. So pharmacy is the track and Lloyd is Shatabdi Express. And I'd like to congratulate all of you to have boarded this Shatabdi Express, and nothing can stop you. So all the very best to all of you. And without taking much of your time, I will hand over to our speaker, Arjun Dasondi sir. Welcome, sir. Over to you.
Thank you. Thank you, Dr. Chitra, and thank you, Dr. Kumud. Am I loud and clear? I mean, is that everything?
Yes, sir. Yes, sir. Fine. Very nice.
Thank you so much. So first of all, I want to thanks the Dr. Chitra, Dr. Kumud, and the management of Lloyd Institute of Technology and Management for inviting me here and sharing my journey, my thoughts, with the budding, pharmacist and the students who inspired to be a pharmacist, in their future. So thanks a lot, first of all, for that. And to start with my introductions, thank you, Dr. Chitra, for my kind introductions, and I will just share a little bit more about with the the students. I did actually got my the admission in the my graduation course in 1996, right, immediately after my 12th. And one of the thing which I would like the students to know is that the why I chose a pharmacy. Over there are different opportunities which is there, like I mean, if I'm talking about 1996, it would be primarily like either you can go to engineering or you can go to the medical, or otherwise you choose the the other science course, like BSc, or you can do a BCom, or you can get into a the other courses. First of all, the pharmacy as an professions, and as an the okay. First of all, another disclaimer is that I don't have any formal presentation prepared for it. I thought it would be great to speak with the students heart to heart. So yeah. So with that, when I started, it's always good to choose a technical education, over your normal graduation program. I mean, it helps you to build your your resume, first of all, in case you wanted to further pursue your field into a pharmacy. So and why I'm saying this with the with the lot of experience, that not necessarily that many of my colleagues and also my my juniors and people whom I seen, they pursued pharmacy as a continued as a profession after their B.Pharm. They went to do a different field. They went into a very tangential field like management. They joined into an the market research. They joined into a developing or maybe not purely a marketing for pharma, but also a FMCG and other such organizations. So what I wanted to emphasize here is that the pharmacy is, many times we connect that, okay, if we are doing a pharma, then we will be restricted or would be framed, or we would be stay into this field. That's not the case, and for the obvious reason that anybody who wanted to do kind of any graduations before they wanted to go into any academic or any government opportunities or and study abroad, pharmacy really provide a the good platform to start with. So that is one of the reasons that I started, I chose my pharmacy as my the choice to do my graduation. Post that, I worked with a pharma company for sure. I started my career with Ranbaxy way back in 2000, and worked there for a couple of years, and then and again got into my master's program. While I was into a kind of a manufacturing and operations there, uh, I got my admission into a master's into in the medicinal and pharmaceutical chemistry. Now, as I worked with the Ranbaxy, I got an opportunity to do my research work there, into a Ranbaxy R&D, and then publish that into an Indian Journal of Pharmaceutical Sciences. The work was on the quality, the quantitative structure activity relationship of benzodiazepine derivatives as a anti-diabetic agent, and came back into a Ranbaxy into formulation development. Now, why I'm emphasizing on this, because I did my master's in chemistry, why I pursued my career into a formulation development. And again, this emphasizes that, whatever post-graduation, even if you do, it does certainly give you a kind of an aptitude and analytical abilities to understand and build your understanding about the subjects. But at the same time, it doesn't restrict you to be in that stream. You can always choose the formulations or clinicals, or the or maybe management, and that's where I will come eventually. Post your even post graduations. Post that, I worked into one formulation development for about 5 years with Ranbaxy, and developed a lot of key formulations, ANDAs and NDAs formulations, Para-4 formulations. And then I went back to another company, and I want to mention that, again, that was the only pharmaceutical companies, hardcore pharmaceutical companies I worked for. So which means that, even when you start your career with the pharma, it doesn't that, you will restrict there, or that's not the only opportunity. Like what typically we understand that, okay, if I start my career or did my M.Pharm, and then started my career with pharmaceutical research organization, then my obvious choice would be the other pharmaceuticals companies, like, from Ranbaxy, the natural choice could be Dr. Reddy's, Lupin, Cipla, Glenmark. But actually, I took another career move into an super specialty company called ColorQuant. It's a US based company, and they are working into a specific excipients, which are like used into a formulation development, like for sustained release formulations, for delayed release formulations, for a very key, the moisture barrier kind of formulation, where you need a lot of. So there I joined as a technical manager for North India. I worked there for 5 years, and that's where I explored that, okay, beyond pharmaceutical industry as an career, there are a lot of other the back functions, basically, where there is a huge opportunities to build your career. So there are like Dow Chemicals, they are Evonik, the BASF, right? So all of these companies were, and they were full of the opportunities for a pharmaceutical profession to come in and contribute, because this industry is actually developed the ingredients, for the formulators in the pharmaceutical companies, to enable them to deliver the high class the formulations and opportunities to build patents. So I saw, okay, there are opportunities there, huge opportunities there. Having said that, that was the the only excipient or super specialty excipient company which I worked for. Post ColorQuant, I moved to made another tangent into my career, which has opened another plethora of opportunities to grow, and the field is on health supplements, right? And I joined Amway in 2011. So when I joined Amway in 2011 as a formulation development manager to head the nutritional and wellness portfolio for development, what I realized that there is a gamut of opportunities even in this field. I mean, I've been associated with Amway for about more than 11 years now, and grown into my career into a different field. I'm responsible right now for packaging development, for the process development for beauty, personal care, home care, which means that going a step ahead, that in the pharmacy, if you have an understanding about chemistry, because see, the overall the understanding which this field give is that it enables you to understand the science of the basic science of the chemical structures, biochemistries, right? If you talk about the pharmacology, then the pharmacokinetics, pharmacodynamics, which can further help you to get into clinical stuff, clinical research and things. But what I'm trying to make a point here is that that's one of the reasons that I feel see that the pharmacy is one of the the should be uh, uh, your choice of a field to choose into. And certainly, as Dr. Chitra and Dr. Both mentioned about the institute like the Lloyd, who is now kind of leading into a Delhi NCR and doing a lot of good research work, great laboratories, providing a lot of infrastructure to our students from the B Form stage itself. Is a great the institute as well as the career opportunities for the students. So, coming back to the another diverse field in which the student can choose their career is now growing field of wellness. While in the pharmaceuticals, we research a lot and work around the formulations uh, for and the drugs for the prevention and cure of the disease. How does this wellness industry has groomed is that what can be done to prevent to get into the situation, right? Not to get into a the disease condition. Like India, if you see, we are in diabetic capital of the world, which means that we have one highest number of diabetic patients in India. A lot of these diseases like hypertension, lifestyle diseases, what we call diabetes, uh, these all are mostly due to a lifestyle practices, like and the changing environment. I mean, I must say that as well, because it's not purely a lifestyle, but also contribute to an external environment. Like we all are witnessed in Delhi, right? I mean, we all are part of the external environment, which is like very extreme weather conditions. We have seen the kind of smoke kind of situations here, right? We have seen the pollutions which we have encountered in this, specifically in this region and many other regions as well, right? So which means that even if somebody have a good healthy lifestyle, like he eats um, you know uh, good food, healthy food, and have a good routine, like maybe a morning walk or run or kind of stuff. Again, in what environment you are doing your that health practices, right? Or you're following your routine. If you even if you're think that you are taking in healthy fruits and vegetables, then where are these vegetables are grown? Are they been appropriate even or fit for consumption with respect to an external environment where they have been grown? What kind of heavy metals they are bringing? What kind of pesticides been used on it? So the health conditions right now is a conglomerate of all of these situations. External environment changing very drastically, fast changing external environment, and the lifestyle. And the lifestyle part is certainly the kind of the work or the professional and the personal routines now we have is that we have seen that during COVID that we've all been restricted for a while, to be in our the homes, right? So again, and stick to our computers, yeah, for works and for studies and everything, which means that we had a minimum movement of and their physical activities were drastically reduced. So all of that has really globally have posed the challenge, and we are seeing that the mental health is becoming one of the leading situation right now in the world. So how does this industry as a whole, and how is the Amway as a company is leading to deliver these solutions for health and wellness? is that we are world's number one dietary supplement company in a direct selling the industry, and we are also backward integrated to an extent that we grow our own the botanical ingredients, fruits and vegetables in our own organic form, so that the point which I was mentioning, that we can control the quality of the outcome from the seed to supplement, right? So we ensure that we grow them and organically. We develop the processes to extract the active ingredients from that, to an extent that where we can preserve the active component into the botanical extracts. So like, and I give an example, like we have recently, I mean it's been a while, like 4 or 5 years, that we have launched our nutritional traditional herb range in India, so which is tulsi, ashwagandha, bacopa, brahmi, and the triphala. So what we necessarily done, that not only that we have controlled the feedstock and the extraction process, but we ensure that what are the active component in these herbs which are responsible for the the effects. So like in tulsi, it's a ursolic acid. Even ashwagandha, it's a withiness of somnif. In withiness of like withanolines, right? In triphala, it's like tannins, right? Uh, so all of that components, we ensure that we test them, after the extraction process, optimize them into an extract, and ensure that they are delivered into an end formulations. So while there are a lot of the formulations which you see that, okay, tulsi is the most common formulations, or the these are kind of household herbs. At Amway we ensure that it's not only like the tulsi powder or an extract. We ensure that what kind of an active component, how much percentage of active you are getting out of it. So that's another kind of an the field which opens for the pharmaceutical professions, which we called in Amway called global agriculture organizations. So we have a GAO as one of the organizations. Yeah. So if you have any queries, please keep posting your queries, and maybe towards the end of the sessions, with the help of Dr. Kumud, I'll try to address that. So that's another industry. Like now there's a flourishing industry which is growing globally and including India, is the agriculture, right? And when we are talking about the kind of agriculture stuff which we we use into our health and wellness, that's a huge opportunity for our students. And because we rarely talk about pharmacognosy as a field, right? And that's a field where this all the botanical research stuff happen, right? Like in NIPER, there's an whole department for natural products. So that is another opportunities which opens up for the students across the the industry. Now, while we know that, okay, when we do pharmacy, and we do the post graduation PhD and stuff, we can do a lot of this kind of research. But there are also a contemporary field like packaging development, and I see a lot of my even my own team members here are their pharmacists, and then they did their packaging courses, which means that what give them an edge over any other the packaging professional, especially when it comes to health and wellness, is that the industry looks for a candidate who have a good experience on packaging technologies and the components, but also have some backup understanding of in products which are going to be packed into it, so that they understand it well, right? So that's another field where the students can opt for post their graduations. Of course, academia is another huge field. We have seen there are so many, the pharmaceutical college institutes has been coming up, and there is a huge gap there for an the qualified pharmaceutical professional to join and further build the upcoming pharmacy professions and teach the students. So that is another field, because I mean, I think when I took my admissions in the B Farm, I think there was two college in the whole MP. So there was a Sagar, there was one in the Sagar, and there was another one in Indore, from Sri Govind Ram Institute of Technology and Science, from SGSITS, from where I did my B Farm and M Farm. But now I see in Indore itself there are like about 20-25 students, and why it is there? I mean, I think the the institute comes as a result of the demand, right? So which itself suggests that there's a huge demand of pharmacists in India and abroad. Of course, I'm not covering up the part of an abroad education and things, but I keep traveling to a different part of the world, and realize that the pharmacy as such also a profession is hugely respected there, because there isn't something called the hospital pharmacist, which is we don't see much in India, as an opportunity, because most of our medicines are like kind of sold through, of course, the retail, where the pharmacist runs them. But for hospital pharmacy is basically a huge opportunity in the Western countries, where the each farm, the doctors are supposed to identify the symptoms and the disease conditions, and the pharmacists decide that what would be the right medicines, which will be required to treat that the conditions. And for that, there is a lot of the opportunities, and I see a lot of my seniors and juniors are and colleagues are there abroad opting for this career. So that is one thing. Now, coming to the part of our discussion which I want to touch base, is that what it takes to see the pharmacy as a career is, first of all, the attitude. One has to have an attitude that this is not the not to put yourself into a frame of that okay, I'm doing a B Farm, so I would be able to do only this, or if I do an M Farm in this stream, then this is my career. uh, you know Many of my research colleagues in Amway have done a very different kind of the pharmaceutical qualifications and educations, but they are into a research for a nutraceutical, botanical research, analytical research, right? That's one of the point which we have not touched base upon it, right? They are part of that. So keep yourself, open for an opportunities. As I said that, this is my third organizations in like 22 years of career, and none of the organizations so far I've been like kind of a repeated, if I can say that, so which means that the opportunities are vast. The only thing is that how do you keep yourself open, think openly for on that opportunities, and grab them. Second most important thing is that keep adding value to yourself. And why I say that it's important, in all the field, but why I especially want to emphasize in the pharmaceutical field is because we are very fast evolving industry. We have every day there's some new research happening, some new challenges are coming, and uh, new challenges are coming, and this actually required that we are up to date with the most recent research and the challenges coming around. Like we recently saw that, I mean, in 2020 January, we never thought that something of like COVID, will come up and the whole world will get stuck, right? So it's very important that we continue to do a research on and understanding, and continue to build our understanding on the research. The second thing which is important is not only in academic research and things, but how do you are building up your own network, right? Many a times, when you build your network within the industries and academia, you get to know lot of the recent updates happening around, right? So that is another most important thing, that how do you keep yourself engaged, what kind of a this social on the social platform, what kind of the people you follow, what kind of the the industry leaders you follow. So that again keep you updated that what's recent going on. Also, that opens up an opportunity for you for your careers, right? I mean, because then where the opportunities are, which industry is growing, where the career move can happen. That these are some of the things which I would say that apart from your the educational learning and research, you should also be open to go to different industries to do your your summer internships, go to different colleges to learn about the most recent works they are doing into it, right? Do your find in partners with the industries to do your research. Like I just give an example. In Amway, we have 4 research labs in India. So one of them where I'm currently sitting in is in Gurgaon. So we have a full-fledged formulation development lab for solid oral dosage forms, for an advanced level of solid oral dosage forms, right? Which means that we have a facility where all the sustained release formulations and tablets can be done. We can do a bilayer tablets formulations. We can do like MUPS kinds of formulations. We have a booster coder where you can do a top spray, bottom spray kind of formulations and develop your formulations. Then we have a full-fledged lab for the our cosmetic lab. So anything which is on the cosmetics and as well as for the topical applications of the the pharmaceuticals or Ayurvedic or the like we see the Volani and Moves kind of formulations which we can do here. Now also we have a full-fledged analytical lab here and the packaging development lab. So all these 4 labs are housing and the stability lab. So all of these 4 labs are housing here. We have made about the investment of about $3 million in India on the research and to create this kind of infrastructure across the globe. Post that, we have a functional food lab in Chennai. So that's another R&D lab which we have for functional food. Like now because we are seeing that a lot of contemporary formulations are coming. Contemporary formulations are coming up in the pharma. So like for weight management, for vitamins and minerals, people are not very keen to just pop up the tablets, right? So they wanted to get into gummies or RTD kind of formulations, right? Or probiotics kind of formulations, which are ready to drink or ready to mix kind of formulation. So that full-fledged formulation lab for a food is there. Then we have our botanical research lab in Bangalore. So that's where we do our all phytochemistry, phytocomponents research, there. And then we have our Madurai manufacturing plant, which is like about $100 million investments. One of the biggest investment in India by any nutraceutical or healthcare company to build the state-of-art manufacturing unit there. That's where we also have our pilot scale lab. So we encourage the academia to and the students. This is also like our social kind of responsibility. We feel that we should give an opportunity to any students to come visit, have an experience of this research labs. If they have any project which they want to come up, there are processes through which we have to go through. But certainly that this kind of an opportunity is what we as an organization ensure that we enable our budding scientists, researchers to use this the facility and do their research work. So I think this is pretty much I wanted to cover on my talk. And it's 11:40. And if there is any questions, I saw a couple of questions here, but I'll let Dr. Mukund decide on, and I would be happy to answer some of that. Thank you so much.
Yeah, thank you very much, sir. Like students, do you have some queries? You can kindly post in the chat box. So that was really nice of you to introduce the profession and tell the quality of the attitude which a student should develop. And besides, since this is a ever-changing profession, so as I would like to quote like one of the quotation of the Winston Churchill, he said that to improve is to change, to be perfect is to be change of often. So if you really want to be perfect, then you should change. And this is the profession which keeps on evolving. So again, I would like to congratulate the students that they have taken the right choice to be in this profession. Any queries?
Kumud ma'am, we can invite meanwhile Kanchan madam to take up discussion with sir. Meanwhile, the students can put their questions in the chat box.
Yeah. May I please request Kanchan ma'am to...
Yeah. Am I audible?
Yes,
Yeah.
ma'am, you're quite audible, ma'am.
So, good morning, Dr. Arjun and other students and teachers. So I'm having many questions. Of course, you may not be having so much time, but quickly,
I'm sorry to interrupt. I would just like to introduce you first.
Okay.
Arjun sir, Dr. Kanchan Kohli is a renowned researcher and professor from Jamia Hamdard, and she is currently heading our research department at Lloyd. So, madam, she has contributed so much to the field of herbal medicines, and one of her recent contributions is a monograph of Silymarin in Indian Pharmacopoeia. And she has already contributed one patent, which also finds its place in baggage of Indian soldiers who are posted at Siachen and all. She has made nano curcumin capsules for that. So, madam, I'm sorry to interrupt, but now you can take up your questions.
Thank you, Dr. Chitra, introducing me. So, as I mentioned, I'm having many questions. My first quick question is, how can we collaborate with MWay? Because presently our research team is very strong. Strong means we are having teachers from DRDO, teachers from DeepSAR, Jamia Hamdard, CDRI, then IIT BHU. So our research team is very strong, like kind of people from pharmacology, he's from IIT, then pharmaceutics, DRDO, then analysis, CDRI. So our team is presently very strong. I don't think any institute other than Lloyd is considering this point. So we have even developed a very good lab for that reason, and we have done certain like kind of small projects for Cadila also, and then for Alchem. Then presently we are having works with Patanjali. Maybe very soon we will be going to get one project from them. So similarly, I like to and we have kind of MOUs with Dabur, with BVG. One group is there at Pune, which is presently come up with the healthcare. Earlier, they were associated with food products. So they are having even food park also at Sitara, like 100 acres, which is collaborated with government. So like that way, we are having kind of the strong associations with the other industries also. So similarly, I want, how can we associate it with MWay? Like as you have mentioned, you have got these pilot scale facilities. So we are having R&D projects, like many projects I have also developed and our team has developed. Like we are having kind of the gel formulation. It has not come up with any of the industry. So what we are having idea, and even without adding preservative, we have got like 3 years I'm watching. I mean, nothing has happened. It's stable. So even that stability is there, and that gel formulation is not available in the market yet. So because I'm always having the passion with the development of the formulation, and as Dr. Chitra has mentioned, we have developed that curcumin formulation. There's a nano formulation, that is the SNADS, self nano emulsifying drug delivery system, and the preparation name is SNAC 30. Even you can have a look also at Google. So that's launched by Arbro Pharmaceuticals, and we had granted patent in 2014, and the products was launched in 2016. But not much aggressive market is there. So because their interest is in the analytic work rather than marketing. So that's why that product is like that only. And of course, now the doctors, BL Kapoor's doctors, and they are taking themselves also. And during pandemic time, I mean, much demand was there for this product, and slowly and gradually the demand is there of this product. But my question is, since we are having experience with nutraceuticals, cosmeceuticals, pharmaceuticals, and whatnot, like gel formulation, external preparation, derma preparation, and we have recently done some kind of the skin permeation studies for Alchem. For they have developed kind of the gel which they has not been marketed yet, and we have done the skin permeation studies for them. And today is much market for this derma product, as we know, kind of the transdermal preparations, because of preventing the side effects, and termination of the therapy is also possible in case of the transdermal delivery. So people are looking for that reason. And since long I've been also experienced in that field, so I want that we could have some kind of the collaboration, and we can develop the I have developed the product, and Amway can market the product, and that's the way we can have the collaboration. So that's my question.
Yeah. Thanks, Dr. Kanchan. For the very good. I think looks like great work has been happening under your leadership. We do have actually, the lot of collaborations with the institute. Like we have with the IIT Bombay. There we were working on system biology. We have an MOU with them. We do have an MOU with the NIPER Mohali, and we are actually in process of evaluating a lot of other institutes. So I think sounds like you have a great infrastructure and capability, and the common interest, like you talked about curcumin and silymarin. So some of the botanical research which we are leading and working on. So we can certainly connect, the offline, and understand that, how do we as an organization can collaborate and could, bring a win-win situation in the research for each, and also give an opportunity to the students to be partner of it. Like you comes from an Jamia, that's what I heard, and we have currently one PhD. Scholar from an she's completed her PhD from Jamia, and she is there working as as an assistant right now, scientist in our lab. So for doing that, like kind of a postdoc work kind of stuff. So there are a lot of things which we can do, and a lot of collaboration which we can do with institutes like you. But certainly, there are some, the different ways and means through which we have to connect, and maybe we can take that offline if you are okay with that.
Yeah, certainly. I mean, we can have a separate meeting, because you may be busy with other assignments right now. So I'll not take much time, but I've just sounded that we are having really practically, because NIPER Mohali, and with NIPERs, everybody like to work with them, because this seems to be good organization. But nevertheless, we have worked more than them, and so far their product is not into the market, whereas we had given, and I had given 2 more products, like cosmetics product, 2 companies, of course, with no profit right now. But I'd already given those products, and we always look for how we can go for the pilot scaling, and to market our product, and to launch our product. This is our motto. And whatever the small assignments we are giving to the students also, I always look for that how we can go for the pilot scaling, and how we can catch up the industry. But as you know, NIPERs and Bombay, like your SNDT, and now the Narsee Monjee is also coming up with the research, because they are in Bombay, so they can catch up the industries very soon, as we don't have that much facilities with that. But whatever we had, I just want to sound you that we can have this collaboration in the positive sense, not on the paper, but we can contribute the products wise, like R&D products, and which can be scaled by you, although I know I also did the scaling, but that scaling is not from the industrial point of view. Like we had small batch, 1 kg, 2 kg, but of course industry needs the 5 kg batch, 10 kg batch. Then only they will see the stability profile and other things, and then they can go ahead for the launch of the product. Not very soon.
So we do have, yeah. So we, as I said, that we do have kind of a facility where we, this kind of collaboration project can go together and scaled up, tested, and stability can happen. So a lot of that opportunities, and I think we would love to have that collaboration, Dr. Kanchan. Maybe I'll invite you to our R&D lab, and we can have further discussion on it and understand that what all work which you are doing and how we can better collaborate with you. I mean, that's one of the our kind of a motto to be partnering with academia, and we don't, like, kind of, as I said, we don't anything particular rank which we do collaborations. Any institute which is doing a good research and can work in tandem with our philosophy, I think we would love to do that.
So thank you so much. So definitely I like to have separate meeting with you.
Sure.
And I'm very happy that today you are here, and I'm that's why I could able to touch with you. Otherwise I was not before that.
Sure.
I was not aware of this, and I'm very happy that as a pharmacist you have joined Amway, and you are having the other team members also from pharma background, so you will understand quickly, and we can have a kind of the collaborations and contribution also. And I want that both the institute could be benefited and more products come to the market, and our knowledge should not go waste, and we can have many products from the in the collaboration with the Lloyd plus Amway. So that's my kind of suggestion on that. So
Sure.
Thank you so much. So I'll not ask the other questions because not many questions are there, and from your busy schedule you have given so that much time. So I'm really thankful to you.
Thank you. It's my pleasure, Doctor.
Yeah, thank you, sir. Arjun sir, like, it's really nice to hear from you that you are also looking forward to two-way win-win situation. And definitely we are also looking forward for such collaborations, and our MPharm students can also be associated with you. Here, I would like to invite, and in fact, I would welcome our group director, Dr. Vanna Arora Sethi. Ma'am was having a busy schedule, but she could somehow manage. Please, ma'am.
To solve that particular question.
Hi, Kumud.
Oh, I mean, isn't that reality? I mean, that's a reality, right?
Yeah. Hi, thanks, Arjun sir, for this. And such is the complexity of the web world these days that we are attending to multiple meetings at one time. I don't know whether that's a bane or a boon, but you mute one and you enter into another. But it has been such a pleasure, and I was on and off listening to you in between. And I'm sure it was quite an enlightening session for the students as well as faculty. You could spare time on a Saturday morning for us. And also, we'll definitely stay connected after this as well. We have a lot of pharmacy aspirants in the meeting today, other than our own students and our own faculty, a lot of pharma aspirants as well. And since we've been here since the last 18 years now, and like Dr. Kanchan was telling, that we are looking forward to a lot of research collaborations as well as doing a lot of research now, because we've done academics and now we are focusing more on the research part. And as we have seen during the COVID months as well, India is a country of a lot of generic medicines. We do a lot of back calculation. We get medicines from the developed countries, especially the US. We do a back calculation on them, and then we produce our own generics, obviously to reduce rates as well. But as far as drug discovery and is concerned, we are spending a lot of money, companies like Dr. Reddy's and Sun Pharmas and Aurobindo Pharmas of the world. But still we are not able to come up with products, which can be marketed. And then during the COVID years, this development of the 2 vaccines was quite a breakthrough for the pharmaceutical industry. And it gave a lot of boost to the scientists who were also working in a very short span of time, where Pfizer was working in the United States and our scientists from the pharmaceutical field could come up with a vaccine. And we are using indigenous vaccine in India. So that is why the demand of pharma sector and pharmaceutical professionals has grown multifold. And we're really hopeful that we will be in good hands. We have had an intake of good students now. I mean, during our time, when we were very good in studies and there were only 1 or 2 colleges who were providing pharmacy, and now we have got a plethora of private colleges who are doing pharmacy education. But obviously quality is going to survive, and I hope that we get good students with good marks. So we have got a lot of filtering mechanism here as well. So I hope that we would be in good hands, because medicine and pharmacy being very important. And then definitely the kind of work that Amway has been doing, we've all been following your the journey from where Amway started to where it is now. I'm sure that you're going to come up with good products in nutraceuticals as well, like you've been detailing. Just one question, Arjun sir, now that you're here also, is that I don't know if you already answered that or not, but I was curious to know what kind of skills will our pharmacy students need to enter into the nutraceutical industry the way Amway is doing it? What skill should they have? So how can the college contribute in providing those skills to the students? If you could just tell.
Yeah, sure. Thanks. First of all, thanks, Dr. Vandana, for taking your time out. I agree. I mean, in the today's virtual world, we all are into a kind of a multiple and overlapping meetings and kind of things. But thank you, and thanks for inviting me here to talk to students and the your teachers and everyone here. So yeah, I mean, I think very good questions you asked actually, Dr. Vandana, and then because so far what we were kind of and I kind of little bit touch base upon it during my talk, is that we were kind of in a frame that okay, if you're in a pharmacy, then you do your M.Pharm in particular field, and then you go to join some of the pharmaceutical companies, whether it's going to be formulation development, or if you've done oncology, then you will go into some clinical investigations. If you've done into a kind of a prognosy, then you will go probably into some of the the botanical research. And if you are into, like, I'm just touch base in like 3-4 basic our specializations, right? And if you're into medicinal and pharmaceutical chemistry, like me, like I did my master's in medicinal and pharmaceutical chemistry, then probably either into a the analytical stuff, or some the kind of an basic research. But the now over a period of time, that there is a plethora of opportunity has opened up for the students and the professionals into a nutraceutical and health and wellness the business. I mean, we see that it's increasing with such a speed that the pharmaceutical companies, almost all of them, have their parallel department or function, which is they called a wellness. Right, so whether it's a Zydus Wellness, or whether it's from Lupin or from Dr. Reddy's or Sun Pharma, all of them has got their wellness kind of with which they are, because we in India, as per regulations, and I'll come to your question, which is very apt. In India, as a regulations, there are 2 things which we eat. Either it's a food or it's a drug. There is no, I mean, there was no kind of dietary supplements and nutraceuticals kind of things, which is now as an FSI has came in. Because when I think 2011, when I came to this field, there used to be PFA, Prevention of Food Adulteration Act in India. There were never used to be an FSI kind of stuff where there were like new schedule which has been added over a period of time, which has come up: health supplements, nutraceuticals, food for like FSDU, like for special dietary needs, right, or medical conditions, right? So, or foods for sports, things. All of that regulations started coming up. So, what as an college and as an academia, our responsibility is become that to touch base on this part of regulation and field into into the college itself, which is currently a missing link for sure. Because what happened currently, we do the the study into a forensic subject about the drug and regulations related to drugs, right? However, we are not we are yet to get into subjects which we include on the nutraceuticals regulations, the formulations needs, like Dr. Kanchan mentioned about the building up an monograph for into a Indian pharma copia for silymarin, right? So some of that the subjects has to be a core of the the curriculum, where they don't just get into a about the pharmacokinetics and dynamics and other stuff, but also onto the some part of an wellness, health and wellness in terms of regulation, like the FSIs and regulations, because primarily it still fall under a food. So I know a lot of food institutes primarily deal with that, but I think it's very overlapping the educations and the industry, where we are kind of at the juncture where the food is merging as a functional food, right? And that when the functional part comes in, then nutraceuticals is like nutrition plus pharmaceuticals is what. So that's what marriage is happening. So that part is what I think that the if the academic institute like you can take as a part of a curriculum and start building that knowledge in a student early, it will help industry as well as the student to find the opportunity in this field.
I understand that's very insightful. I'm sure students are going to find way into the nutraceutical industry also after that, yeah, there have been some missing links between FDA and the regulations of nutraceuticals as well. Yeah. All right. Thank you very much. Thank you very much for your session. Thanks for your time, and let's connect post session as well. Visit us sometime, and I'll request Annie, who got us connected to you, to invite you to the campus also sometime, and so that we can do more good work together.
Sure. And yeah, at the end, I want to thanks Dr. Annie, so connecting me and giving this opportunity. So
yeah, so in fact, Annie ma'am also wanted to thank you. Like,
Annie, are you there?
Hello, sir. Hello, Arjun sir. How are you?
Doing good, doctor.
And I'm so thankful to you that at such a shortest of notice, you just agreed to it. I know you've been busy, and you were traveling yesterday also, I presume, but immensely thankful to you, sir.
Thanks a lot, and it's been pleasure. Connecting with institute like Lloyd and the research scientists like you, and all the teachers and professors. So thanks. I mean, it's been pleasure.
Yeah,
so pleasure is all ours.
Yeah.
Thank you, sir. Thank you.
I'm also thankful to Vandana ma'am to spare her precious time. And sir, we'll definitely take care that we as academician has the onus to make the students ready. So the missing link which you talked about regarding the regulatory studies, we'll definitely take care of. Yeah.
Sure. Thank you.
Thank you, ma'am. So we end up our session here. Thanks to all of you. Thank you.